everyone. It's Alex Savidge from KTVU, Fox 2 News here in the San Francisco Bay Area. And we want to talk about some of the latest headlines surrounding the coronavirus outbreak in this country. And to do that, we bring in Dr. Vanila Singh, professor of medicine at the Stanford School of Medicine and also former chief medical officer with the Department of Health and Human Services. Dr. Singh, always good to see you.
Great to be here. Thank you, Alex, for having me.
Sure. Let's start kind of big picture across the country. Overall, since the summer months, have seen improvements in the cases here, and things generally trending in the right direction. But when you look at certain places and then certain groups, there are areas of concern. And the CDC had a study that found a real spike in cases among young people. 18 to 22-year-olds, they saw weekly cases jump 55% in that group between August and September. Obviously, a lot of the focus is going to be on colleges and universities reopening. What do you see happening here?
Well, so certainly this is not surprising. This is the start of school for so many people at the universities and college level. And these are the group 18 to say 25 who definitely have a sense of invincibility, feel like and they have that on their side. They're generally healthy folks and they're likely to come out okay. And so therefore they are also not likely, unfortunately, to hold to all those important guidelines that we know are important in the fight against COVID. So staying socially distanced, I think that's probably the number one issue. They all were understandably very excited to come back to college and see their friends. I'm certain, and I've heard personally from a lot of them, that it has been a tough several months. And so they probably put caution to the side and had been seeing each other. We know that there are social events. Wearing masks at those events are also not common, not frequent. We saw a lot of video footage of this over the summer. And so you can imagine what it's like. That had to be balanced against, of course, the very important years of college and study. So it is true that the increase in COVID positive cases has been transmitted more so in this group. And my big warning to them is to please remain cautious, because even if they come out okay clinically, they serve as real vectors to people who may not be so. So they need to have that sense of responsibility.
Right. Even if maybe a number of those young people don't get serious symptoms from catching the coronavirus, you got to think about, well, what if they travel back home here to see their parents or relatives in the next few weeks or months or during the holiday time? There is that concern there of bringing that back to people who are more at risk.
That's right. And the key is that they follow the self-quarantining guidelines of 14 days. I mean, they need to, as soon as they know about it, stay within their dorm room or their apartment. My understanding is actually, certainly at Stanford, they were noting that most of these students are actually staying in apartments and Airbnb type living situations. And so when they do that, they need to treat it like anybody else's, so that they go through a self-quarantine and reach out to their doctor or physician on campus or nurse on campus, who can then help guide them as to what they need to do in terms of testing and retesting and getting symptomatic treatment if they need that.
If outbreaks like this continue in this age group among young people, you think we are going to start to see more colleges kind of dialing things back on the number of people who are coming onto campuses for in-person learning?
I think that's highly possible if the students don't adhere to the self-quarantining and start making changes in behavior in terms of social distancing and mask wearing. I mean, they have a great privilege right now where many of the colleges have opened up. They have a hybrid situation, and they're allowing them to learn at a very important time. And I know the kids, they want to learn, they want to be there, they want to experience all that college has to offer. But, you have to be very clear that you could lose this great privilege, because the universities are going to also look at how do their staffing do. Those folks who aren't young students, but in fact maybe older and are there for the actual students, and how are they faring, and the community around it as well. I think that if the communities have concern if they're noting, say, in the restaurants or other places that these college students who may be symptomatic are coming in. I think that that does not bode well for them. So I would really have them pay attention so that they don't lose this privilege right now.
Yeah, that's a good way to put it. It certainly at this point is a privilege to be on campus and doing in-person learning. So you have to be part of the solution, right? So let's bring things back here to California, and specifically the Bay Area where we are. And today we are seeing actually indoor dining reopening in San Francisco for the first time in more than 6 months since the beginning of the pandemic. There are actually going to be restaurants that are open indoors, albeit it's at 25% capacity or up to 100 people, customers, I should say, inside those restaurants. Churches also allowed to open up indoors at 25% capacity, among a number of other places, businesses as well that can reopen. What is most important for business owners and the customers who are going to be now going inside some of these places, especially the restaurants, to eat? What's most important to keep in mind here to keep everyone safe?
Well, one is, again, making sure that the businesses are making it absolutely clear to their customers that if they're going to come, they have to play by the rules, meaning ensure, number one, they're not symptomatic. I'm not certain if some of the businesses may be testing or doing additional checks, which is going to be, I think, very reassuring for the public. But the businesses are incentivized to finally get this opportunity to have some capacity indoors, which is important as we enter the fall and winter. As we know, it might not be so easy to have outdoor dining when the weather changes. And so I think there's going to be a great incentive to do that. Their economic livelihood depends on it for the staff and the owners, for the restaurants, as well as for the churches. A lot of people have been missing their spiritual support, have actually probably needed it in these tough times, not only just due to COVID, but the California wildfires in our beautiful state, and certainly all the other challenges that we've seen this year. And so I would hope that these entities are able to keep to those provisions so that we're able to really maintain it through what could be a very challenging time in the fall and winter. And one other key thing about this is that for all those who are expecting to get their flu shots, I would say get it early this year, knowing that it offers some protection and also limits the confusion that can occur with the symptoms of flu versus that of COVID. Mm-hmm. Because of COVID, there's going to be a lot more precautions taken. And it's very easy to see that our own hospitals and clinics can quickly become overburdened, which was really the initial reason we went to flatten the curve early on. And so we really want to make sure that that situation is proactively addressed.
Yeah, certainly so. Yeah, it's going to be the responsibility of everybody, customers, business owners, to do the right thing, to be safe, to be upfront about whether you have felt sick, whether you've had the coronavirus. I mean, you have to be honest and upfront. And it does sound like, I think I was telling you that that's what's going to happen at restaurants in the city, San Francisco, is that they're going to sort of do a health screening, health questionnaire, and ask folks these questions and get a verbal acknowledgement that people have not been exposed to coronavirus, have not tested positive recently. You think that, how effective is that going to be to make sure that you don't have the virus spreading in these indoor settings?
Well, it's a great reminder for people to think about the symptoms that you may not even always think of. We know about coughing and sneezing, but it could be a headache, muscle aches, weakness, some change in your symptomatology that, as we go about life and maybe we're starting to feel a little normal and even celebratory, if there's an occasion, really stop to remember that we're in the midst of a pandemic and that we're entering the colder months, and we really are still some time away from the vaccine, and be it, even if it happens perfectly, it would only be available for emergency use authorization. And so we really, really have our own personal responsibility. So I think it serves as a great reminder that there's something important about this. Also, it's probably a means to also legally tender that, look, we're all responsible adults, and we're engaging in this activity whether it's dining or other businesses. And just a reminder that, look, at this time, just take it seriously. You can always dine another day, but if you have any cause for concern, stay home.
Absolutely. And if folks out there don't feel comfortable dining indoors, then they obviously they might be making that choice as well. It may not be for everybody. Not everybody might have that sort of comfort level built up at this point. Let me move on and ask you about an interesting study here that was published in the journal Science, and it examined the role of super spreaders in transmitting the coronavirus. And this was a research that was done by researchers here in the US and in India, and they examined more than 500,000 people in India, and they were tested after they came into contact with someone with a confirmed case of COVID. And in essence, what they found is that just 8% of the people with COVID-19 accounted for 60% of new infections. So obviously, really kind of zeroing in on this idea of super spreaders really being responsible for a huge number of the cases that we see. What do you think we should take away from these findings?
Well, this is such an interesting study because it really goes into India as well as North Korea's strength. Both of those are the real key countries that have followed through on contact tracing. So they were able to identify folks who were infected with COVID and go and trace out the people that they had come in touch with. And it was a large study, the largest of its kind in the COVID epidemiological study area. When they looked at all these people, the key takeaways that they found is that only a minority few were responsible for the vast majority of spreading the infection. And what it really boiled down to that they were considering, and of course more studies and more data is always needed, but that it really came down to the behavior of the individual in terms of where they went, so what ambient conditions, and how long were they near somebody, and how close were they to that person. And so if you think about all that we're stating in terms of social distancing and whether someone's at an indoor outdoor event, it's very important, very relevant in terms of the ability to spread. The other key takeaway is that they weren't certain how much biological factors played a role in terms of the ability to spread. So there's a good news and a bad news to this. In the super spreader thing, one, it comes down to there are some individuals who are responsible for more of the spreading of the virus. But the good news is that the vast majority, maybe 7 out of 10 people on average who get COVID are not actually spreading it. And if we can change the behaviors of those minority of people, it may actually go a longer way than we realize. The other key thing was about the children and the pediatric population in general. What they found is that they generally were transmitting the virus about 18% of the time, which is higher and is similar to the adults. Now there could be more factors at play. Maybe it is to other children, and it'd be interesting in terms of the close contact that kids may come into each other at the schools. Again, this was done in India. What their provisions are, how they are approaching the lockdown and COVID in general is going to differ. So not everything is a clear takeaway, but the key thing is that super spreader and behavior are definitely at play here.
Yeah, and when you talk about super spreaders, as you pointed out, the conditions, the setting seems that seems to be the key here. It's about the proximity you are to an infected person and the length of time that you are in close proximity to them, right?
That's right, exactly. And it actually makes sense in terms of the science that we know, but it's great to be able to have a study of this magnitude to go and do the contact tracing, which they did with a phone call. They do acknowledge that they may not have been able to get in touch with all the contacts, so the numbers may be better or worse, whatever way you look at it. But the bottom line, it's a significant amount of data that does indicate that it is the conditions that one is in. So are they in a close packed bus, which you may find much more so in other countries than say ours, but how long were you near a person that you were close to? and how close were you to them. Both matter. So if you're close to someone, but it's really brief, it's unlikely you're going to be successful in transmitting the virus. But if you're close to them for a while, say 15 minutes, then yes, that goes up. That makes sense to us. And certainly if you're further away, but close to them for a while, then that the further away you are, the less likely you are to transmit it. Things that we've known, but this definitely makes the case for good behavior.
Yep. Okay. Yep. Proximity and length of exposure. That's those are some of the key factors here. All right, we'll leave the conversation there. Appreciate your time and, of course, your insight on all the topics here. Dr. Vanila Singh from Stanford School of Medicine and the former Chief Medical Officer with the Department of Health and Human Services. Appreciate you doing it. We'll talk to you next time.
Thank you. Thanks so much.
Take care.